Did you know that dogs have 6 eyelids, 3 for each eye?
Say what?
Many pet owners don't. Well, at least until something goes wrong with one of the third eyelids that are normally hidden from our view. So if your dog's eye looks something like this, then he may be suffering from cherry eye. Watch this video to find out exactly what cherry eye in dogs is, what can cause it, and how it can be treated. Hey guys, Dr. Peter. I'm a veterinarian from South Africa. Now, we are all familiar with a dog's upper and lower eyelids as they function pretty much the same as ours. But many mammals, including dogs, also have an extra third eyelid located inside the lower eyelid, also known as the nictitating membrane. This eyelid should be flat against the corner of the eye socket and is usually not seen. The reason why dogs developed this third eyelid was to serve as an additional protective layer for the eye, especially during hunting, fighting and digging in dirt, which usually led to debris accumulating in the eyes. The third eyelid was therefore designed to sweep this dirt and other material off of the surface of the eyes in order to keep them moist and clean, almost functioning like a band-aid to the eye. But this is not the only reason. In order to keep the eyeball clean and healthy, it needs to be lubricated by tear film, which mostly consists of water, oil and mucus. The oil part comes from glands inside the outer eyelids. The mucus comes from glands in the conjunctiva, which is the pink part inside the eyelids, and the water part comes from tear glands, also known as lacrimal glands. Now, each eye has 2 tear glands, one just above the eye and one located in the third eyelid. The gland in the third eyelid produces up to 1/3 of the total tear film water, so as you can see, it is really important to maintain the function of this gland. Okay, so why does this third eyelid pop out? Now, under normal circumstances, the gland of the third eyelid will be anchored to the lower inner rim of the eye by means of a strong fibrous attachment. In certain breeds, this attachment is weakened due to bad genetics, which allows the gland to slip and prolapse more easily. Other times, when the eye gets infected, the tear gland in the dog's third eyelid becomes inflamed, leading it to swell and prolapse. Brachycephalic breeds, meaning flat-faced dogs, such as bulldogs, Boston Terriers, Pekinese and Shih Tzus, are more predisposed to developing this condition, as the conformation of their faces, meaning prominent eye and flat noses, causes these attachments to weaken. If the gland is out of its normal position, blood circulation becomes impaired and the gland may swell, and this may cause the gland to stop producing tears as it normally would. Now, when the third eyelid gland pops out or prolapses, you will notice a swollen red pinkish mass on the lower eyelid near the nose or muzzle, almost looking like a bright red cherry is stuck inside the eyelid. Hence the name cherry eye. This cherry may either be large and cover a significant portion of the cornea, or it may also be small and only appear every now and then. While this condition is usually not extremely painful, a dog may sometimes paw or rub at it as if it is itchy, which may irritate it even further. If the third eyelid is severely swollen, the dog may also struggle to close its eye and will therefore show signs of excessive squinting, and you may also notice excessive tear production for the first couple of days until the gland dries up. Now, the diagnosis of cherry eye in dogs is pretty straightforward. If it looks like this, then you can be pretty sure that the third eyelid has prolapsed. But as with any vet visit, your vet will need to first get a thorough history and perform a proper clinical exam to make sure that there are no other problems or concerns regarding your pet. Your vet will also need to see how extensive the prolapse is, as this will help guide him to decide what surgical technique he will use to fix it. And if the condition is more advanced and the dog managed to damage the eye, your vet will obviously need to take that into consideration as well, and he might therefore decide to perform a fluorescein stain test to look for corneal ulcers, and if he suspects a tumorous growth in the third eyelid, he may also perform an ultrasound or send a biopsy to the lab to have it properly diagnosed. Now, As this gland will become exposed to the environment when it is prolapsed and can therefore easily get damaged, it is important to treat the condition as soon as possible. Remember, the third eyelid gland produces up to 1/3 of the water portion of the tear film, so without adequate tear production, your dog is much more likely to develop a condition known as dry eye. Dry eye, also known as keratoconjunctivitis sicca, is a serious, very painful condition where the eyeball basically dries out, forming a thick yellowish discharge that can lead to infection and eventually blindness in the dog's eye. This condition requires expensive, time-consuming daily medical treatment to keep the eye both comfortable and visual. If you want to learn more about dry eye in dogs and why this is such a serious condition, then check out my video over here. Now, simply pushing or massaging the cherry eye back into place with a wet cloth at home may work if the gland just popped out, but this is typically only a temporary fix if it works at all. So it is always better to bring your dog to the vet if the gland continues to pop right back out. Now, there are mainly two different treatment options for cherry eye. Either the third eye gland is replaced into its proper location, or the third eyelid gland is removed completely. The former is by far the best treatment for cherry eye, as this will help preserve the function of the gland. Now, there are basically two techniques for doing this. The traditional tucking method, also called tacking, is probably the most common, and with this method a single stitch is permanently placed in order to draw the gland back into its normal position. There are a couple of possible complications with this method, although rather uncommon. Firstly, if the stitch unties, the surface of the eye could become scratched by the suture. This will cause the eye to become suddenly painful and may lead to inflammation and infection of the cornea. Secondly, the tuck may not be anchored well enough to hold the gland permanently intact, which may require a second or even third tuck. A newer surgical technique, also called imbrication or pocketing, is much more effective with better long-term results. With this method, a small wedge of tissue is removed from directly over the actual gland. This technique is a bit more challenging, as it is not always easy to determine how much tissue needs to be removed. Tiny absorbable stitches are placed to close the gap so that the tightening of the incision margins will push the gland back in place. This does also come with its own potential complications, including possible inflammation or swelling where the sutures were placed, inadequate tightening of the sutures around the wedge that was cut out, and sutures that fails to hold, which again can lead to injury to the eye. Some surgeons may combine both techniques to achieve the best replacement possible, but even with the best technique and skills, recurrence of cherry eye can sometimes still happen. Many pets that have a prolapse in the one eye will eventually experience a prolapse in the opposite eye as well. If this happens, you will need to bring your doggo back to the vet so that a second surgery can be considered. If your dog has been operated on, you can expect to see some post-operative swelling around the inner side of the eye, but this should resolve and the eye should be comfortable and normal in appearance again after about a week. Your vet may also prescribe some topical anti-inflammatory eye drops to help reduce the swelling, and if infection was present, your dog may also receive some antibiotic eye medication as well. Your dog may need to wear an e-collar until the eye has completely healed, as this will help prevent him from causing self-inflicting damage to the surgical site. Your vet may also want to monitor the tear production of the affected eye after surgery using what we call a Schirmer tear test to ensure that the replaced gland is still adequately producing enough tears and that your dog doesn't develop the dry eye condition we talked about earlier. Now, again, surgical replacement of the third eyelid is always the first choice of treatment due to the risk of developing dry eye if the gland is surgically removed. But in severe or chronic cases where the gland keeps on reprolapsing, there may be no option other than removal of the gland, especially if the function is already severely compromised or even absent. Surgical removal has been the most popular remedy for cherry eye in the past, but because we would obviously like the dog to maintain the greatest amount of tear producing tissue as possible, removing the gland just for cosmetic reasons is not an acceptable first-line treatment method. Now, there's unfortunately no way to prevent cherry eye from developing in at-risk dogs. Cherry eye can sometimes be confused with certain serious cancers of the third eyelid, such as squamous cell carcinoma, lymphosarcoma, or fibrosarcoma. So if you notice this little cherry to your dog's eye, it is really important to take your doggo to the vet to have it checked out. Thank you for watching this video, guys. I really hope that you found some value in it, and if you did, I would really appreciate it if you could just bark at the like button and share this video with your friends and your family. And if you are new to my channel, then welcome. And if you like these types of videos, then consider subscribing, as I'll be posting new videos on interesting pet related topics every week. And as always, guys, have a lucky day, and I'll see you in another video next week. Cheers.